welcome to Jessi's Corner. I will be your host today. My name is Jessi, and today we're touching a sensitive topic. We're actually going to be speaking about attention deficit hyperactivity disorder, also known as ADHD. Now, people with ADHD display age-inappropriate symptoms of inattention, hyperactivity, and impulsivity that are sufficient to cause impairment in major life activities. So, the history of this disorder is, I'll give you guys a little background on it. It's summed up, it's simply been given a new name throughout the years. It's not a new disorder. In the 1900s, children who lacked self-control and showed overactivity or inattention in school were thought to have poor inhibition but volition and defective moral control. So those were other names that were actually given to ADHD before ADHD. And then later in the 1950s, this disorder was called hyperkinesis, which was associated with poor filtering of stimuli entering the brain. And this association then led to hyperactive child syndrome, which was basically just motor overactivity. So we have a guest today, and she'll be speaking a little bit about her experience growing up with ADHD.
Hello everybody, my name is Jessi, and basically to talk a little bit about ADHD, growing up, it was very difficult. As a kid, it was extremely hard to concentrate at school. You know, one minute I'm listening to the teacher, the next minute I'm looking out the window, and then I'm staring at something on the floor. So you can imagine how hard it was for me to basically grasp information and retain it. But schoolwork wasn't hard, it was just slower for me to understand because of my lack of concentration. And so yeah, that's pretty much.
Thank you, Destiny. Well, there's just a couple of questions I want to ask you. How did you think as a child you differed from your peers?
Well, because I couldn't concentrate, it was hard for me to, one, make friends and be friendly. Well, even if I tried mentally, well, like for me, I don't feel like anything's wrong. So, but for everybody else around me, they can tell that I'm being just overly inattentive and just not paying attention, or kind of like all of.
Okay. Well, how does ADHD continue to affect you now?
Now it doesn't affect me as much because I'm medicated, and I also am going to therapy, so that helps. Like, as long as I'm taking my medicine and going to therapy and working on my disorder, then I'm able to function. Because if I'm not, then it's going to greatly affect, my life.
Sure, it's difficult. And I can't imagine what, children feel nowadays when it's so common, I guess. But thank you for your time, Justin.
Thank you.
So now we have Dr. Rachel here to speak to us via satellite. So welcome, Dr. Rachel.
Hi, my name is Rachel Park, and I'm here to talk about the treatments and preventions of ADHD. There are 3 different treatments for ADHD. We can use medication, or parent management training, or educational intervention. Parent management training goes along with the parents to help them learn some skills to be able to cope with their child's ADHD. Educational intervention focuses on managing inattentive and hyperactive impulsive behaviors that interfere with the child's ability to learn in school. Summer treatment programs coordinate with stimulant medication trials, parent management training, and social skills training, and educational intervention all together to make a program throughout the summer for the child to help with their ADHD.
Thank you, Dr. Rachel, for that expertise. So now we have another expert coming in, Dr. Amima. She's also here to speak with us via satellite.
Hello, my name is Amima Hyacinth, and I will be doing the background of ADHD, Attention Deficit Hyperactive Disorder. It is a cognitive behavioral disorder with neurological underpinnings. Symptoms of ADHD are hyperactivity, inattentiveness, and impulsivity. ADHD is not a learning disorder, but has similarities of a learning disorder. Some are slower to grasp and process the information. There are many causes of ADHD, such as malnutrition, maternal smoking, and asphyxia. It is likely to run in families, meaning genetics. There are several different methods in diagnosing of ADHD and several treatments of ADHD. Medications are used to help deal with this disorder as well as therapy.
So now for our next guest. This is Destiny's sister, Jourdan. Welcome, Jourdan.
Hi.
Hi. So yeah, you're here today to just talk about how it was growing up with your sister, you know, with her disorder. So I just have a couple of questions for you. Well, how was it growing up with her?
Well, it was really hard actually, because sometimes I would have friends over and she'd just be all over the place, and I'd be like, go away, and she was always just right there, all in everybody's face, and it was just really hard.
Yeah.
But now it's a lot better since I've come to understand her disorder and she's come to understand it. So, we get along a lot better now.
Right. So you did your research on it?
Yeah, I did. I looked up the diagnostic criteria for ADHD, and it included inattentiveness, hyperactivity, and impulsivity. So inattention would be, so she wasn't able to focus on anything. She wasn't able to focus her attention on anything. We would probably be having a family night, watching a movie, and she just get up, maybe leave, or come back and start just dancing or something like that, which will also be, could also be hyperactivity.
Right.
So yeah, she was always on the go basically. Couldn't hardly ever sit down and just rest. She always needed to be active.
Right.
And impulsivity, she never let you finish your thought. She always had something to say. So yeah.
And we would also, we'd like to thank Destiny, first of all, for joining us and for sharing her story. And we'd like to thank Jourdan and also Dr. Rachel and Dr. Amima for coming and sharing our expertise with us. Well, thank you all for joining in today, and we'll see you next time on Jessi's Corner.